Cindy and I could not wait to get Mr. Brett West on this Zoom with all of us today. And you guys are also going to hear from James Zing, who has so much knowledge about these products as well. I want to start you guys off with, my name is Lindsay Yoakum. I am a mom of three very busy teenagers here in Richmond, Virginia. Are any of you mamas or grandmothers or grandfathers or fathers, busy, busy, busy people, right? My daughter, my oldest daughter, who's 17 now, she was 16 last year, was diagnosed with thyroid cancer. And we went down a very, very hard road, very long battle. She's doing great today, thank God. But I jumped into this thyroid hormone health rabbit hole. I went down this rabbit hole of learning what it is that we were all really, really needing in our bodies, what we were missing in our bodies, what could really help us in so many ways. And I found some doctors talking about these hashtag skinny drops, which they are so much more than that, right? These body balancing hormone supplement drops. And I went down this rabbit hole and I was super, super intrigued. I saw so many different stories, so many different people having the most incredible results that I knew that I needed, right? I was missing a lot of this stuff in my life, in my body. You guys, I've been on these drops since December, and a lot of other products you're going to hear about today, right? I'm down 38 pounds, almost 40 pounds, and it has been an absolute incredible journey. Just the way I feel, the way I sleep, the energy I have. My kids tell me all the time, they're like, Mom, like, I have a 17-year-old, so 17-year-old, 15-year-old, and a 13-year-old, and they're telling me things like, Mom, we can't believe like you're moving like this on the beach. We can't believe, they're used to seeing me struggle walking, right? Holding an extra 40 pounds, walking through the sand, or just having to take naps in the afternoon. I'm there, I'm present. I have this energy. My daughter told me just a few weeks after taking the drops, she said, Mom, you're like happy, like so happy. I was like, I am, like, I feel that. So these products just do the most amazing things. And today we have the honor to hear from Brett West, who is the head of research and development with our company here at Partner Co. And he's really going to share with you why these drops, why these other products, right? Why Noni? What it is that these products have in them that are doing the things they're doing, and what the future looks like for that. So I'm actually going to pass this over to James Zing. If you do not know James yet, James has been a part of these drops. He has worked with these products for over 13 years now. He has so much knowledge. He's seen so many things. He's the reason Cindy and I are here, right? He just opened his heart and his wisdom to us, such a servant leader, and has shared the vision of the products, the company, and where we're going. So I'm going to let James talk a little bit about that and introduce Brett West to you guys.
Thanks so much, Lindsay. And can we all just give Lindsay some love in the chats for her amazing transformation? Like, that's really what this is about. Not only is it a physical thing, like an outward thing, which, of course, if you look good, if you feel good, but it's the inside out. And that's going to be one of our messages today, which is balancing things there with real stuff, scientifically backed, so you get those results. So, Lindsay, we're so proud of you. Like, you just continue to transform. Like, it's amazing, and an honor to be here with you guys. Hey, everyone. So I've been dealing with these products for 13 years, actually. And just a quick story. I got in, I'm the type of person that is super analytical, very skeptical. Is anyone else like me? Like, I'm the one, I grew up studying biology. I grew up wanting to be a medical doctor because I'm Chinese and that's what you do. So when I got it in, my mindset was very much on pharmaceuticals. My mindset was very much so there's a pill for every ill. So to be honest with you, when I saw supplements, I thought they were expensive junk. I thought they were scams. I thought, what's the point of these types of things? So when I got introduced to the Partner Co products, specifically the drops, and I heard of this thing that you could lose weight faster. I grew up a chubby kid too, so I'm like, I've tried it all, I was skeptical, But what really got me was looking at the science. What really got me was later meeting people like Brett West and understanding that not all products are made the same. And you have to be very careful about what you put into the products, how you do it as well too. And I tried it. I lost 25 pounds in 40 days with no exercise on the drop. So definitely my experience was true. But then I really loved internally understanding what the products are doing for me as well too, right? So I have the honor today of bringing up someone that is so intelligent, but also he's someone that is so filled with love for you. And that's really rare to find. Maybe you've met someone that's very analytical and sciencey before, and you're like, they're cool, but they're kind of like over my head. Brett West is not like that. Brett has had decades of experience in research and development. He's the head of R&D for PartnerCo now, but he's had an extensive history on Tahitian noni juice specifically. And if you want to look up articles, just look up his name, B-R-E-T-T West. Look up on pubmed.org if you want to get geeky and stuff. I'd actually love to ask Brett. Brett, it's an honor to have you today. I know you're about to travel all different types of things, but Brett, curious, how many papers have you published dealing with the PartnerCo products by now? Do you know?
I'm trying to think if it's 80 or more than 80.
Wow. Brett, that is 80 more papers than I've ever published. It's an honor to have you here today. We have a bunch of questions and in the chat too. If you do have anything as we go along, we'll do our best. Feel free to chime in as well too. But Brett, for those of us that don't know you and your background, do you mind sharing kind of like who are you and what is your capacity within PartnerCo?
You mean questions like I like to take long walks on the beach and then,
Yes.
No. Okay. I'll get a little more professional in this answer. So let's see, okay, James, I'm kind of like you. Just briefly, I studied molecular biology as an undergraduate student, and then for my graduate program at the University of Arizona, I was in pharmacology and toxicology. That's when I first learned about noni. So that's what got me into this business. I was kind of like you, more of the traditional standard science path. But we use science. I don't want to say traditional standard science path. We use that actually in this company too. All these, we can do the same things that are being done for pharmaceutical development that we can do here to evaluate products and, and verify their benefits and efficacy. But I was introduced to noni, Tahitian noni, by my sister-in-law, who was working for the company when it first began, one of the previous PartnerCo companies. And she explained some things, what early science there was on noni, and kind of got things mixed up. And frankly, I thought this sounds like witchcraft or voodoo or something. It was, my impression at the time. So this shows that how ignorant I was, I guess, in natural products early on. I thought it was kind of a hippie thing because I knew my mom and her friends, they did the 60s, and they were into herbs and things. And I was kind of, I guess, a little aware of that area, but not much. I thought it was sort of a hippie thing, And so I started doing some more research before I ever started working on this. And there's a little something there. An opportunity happened that I was asked if I was willing to join the company at the time in the newly created research department to validate Tahitian noni. And I said, okay, I'm a scientist. There are answers. Yes and no are both answers to research, right? So I'll do this for a year. And if there's nothing there, I'm moving on. So, that was a long time ago. That was in 1997. So this has been 20 years ago. So I've been in this industry doing work on this. Noni got me in. I'll talk a little bit about that. I know you have questions about other products too. But that's my story there.
Wow.
Into this.
And now you're selling witchcraft voodoo products. And
what we've been able to do is apply the credible science to the development of these products, the validation of these products, And so I'm going to share with you one thing before you get into some questions, though. One thing that's important to us at PartnerCo is that if a person's going to spend $1 on products that we offer, they better be getting something valuable for that dollar. We're not here to rip people off. We're here to deliver things that actually, do something for their health. So that's important, and so that's why we operate the way we do. And that's actually from the top, Darren, all the way down, is that's a commitment. Things that work, things that deliver what they're supposed to deliver. One more story, and then we'll get into some other things. Right now, I've got one of those papers that you talked about under review right now on the authenticity of noni, how to identify noni, because we found over the years that there is actually fake noni on the market. I did a survey, bought a bunch of noni powder products online from big retailers like eBay and Amazon, and about 75% of them don't have noni in them, actually. So we're actually putting that information out there, so that industry and governments and others can keep everybody honest, that noni. So why I bring that up is PartnerCo is committed to delivering high quality things that actually are what they say they are. And in an industry, that's not always the case. I don't think everybody is trying to be deceitful, but these companies, frankly, don't always know what they're doing. They just don't know. They're not expert. They don't know. They're just trying to sell something. And so we don't want to be that. So I tell you that to give you kind of a feel for what we're about at PartnerCo.
That's so huge, guys. It's so true, because people might say, well, I've tried this supplement. I can get it online for quote unquote cheaper or whatever, but you get what you pay for. So you want to make sure you get something that you trust. And that's why till now, I believe the stats of this on Tahitian noni juice, there's been 200 million bottles sold or something since the beginning. A lot. Yeah. And the Slenderize system, 1 million units and more coming as well too, So Brett, thank you for that background. We love to go through some of the main products. We have a lot of products at PartnerCo, but there's some that are kind of leading the charge right now. And we see the pictures, we see the testimonies, we hear the stories. Maybe if you're listening to this, maybe you've even experienced them as well too. So it's one thing to experience it. I believe in testimonies. I think that's important, right? That's the result. But I also believe there's another level of confidence when you understand why things work the way that they do. So you can be like, oh, this isn't just a placebo thing, which is a real thing as well too, that effect. So the first one I'd love to ask you about is this Slenderize program, this skinny drop phenomenon. Like, it's working. We're seeing it balance people's hormones. People lose weight, they feel better. You saw and you heard it from Lindsay. But what I'd love to ask you is, Brett, there's a lot of ingredients in here, formulations, but when you take and you think about the Slenderize system, what are some of the main ingredients or the science that's actually working? Like, what's happening with Slenderize and how are people seeing these results?
Well, this is a good question. And there's not just one thing going on with a successful weight management program. It's difficult to narrow it down to say this is one mechanism by which this is affecting the outcome. There are a lot of things going on. So, James, you're a biologist, right? You background in biology, cell signaling, and there's a lot of crosstalk between different types of cells in the body. And so I don't want to get too geeky and get over everybody's head, but I think a simple way that people are talking about is hormone balance. But how does that happen? How that happens is you have ingredients that interact with cells, right? And when they interact with the cell, there's different, think of a cell, think of a balloon. I'm just going to say a balloon, right? And there are receptors on top of this balloon, okay? Places where these ingredients can go and lodge in there. When they do that, that triggers a response in the cell. The cell will, so it's kind of like if you and I meet on the street and I smile at you, there's a response, right? Inside, hey, I feel pretty good, right? And then if you smile at me, I say I feel pretty good, I'm going to pay that forward. and the next person, I might smile to them, and so forth and so forth. So this is maybe a simplified way of talking about the cell signaling. And another way might be that I'm going to cross the street and there's traffic's really busy, but you can't really tell because there's a blind corner. I'm about to go, and so you reach out to me and say, hold on, listen for the traffic first before you cross, because my experience has taught me that. So then the next time I'm out that corner, I'm gonna, so what I'm trying to say is there's a more complicated process going on, but this is sort of what's happening with these ingredients. You put ingredients in and you get a response from a cell, and they talk to different kinds of cells, and you get a bigger community response in the body. And so some of this is what is dysregulated, meaning it's the normal processes aren't happening the way they should in cases like a diabetes and obesity and some things like this. And so you need an intervention. So let's say everybody's on the street not talking to each other, and they're crabby, right? And negative energy, and nobody's looking out for each other. Somebody's got to intervene and say, hey, I'm here for you, you know, I'm positive, and then you can change the mood. So while this is maybe not the technical reason you're looking for,
Oh, it was great.
mentioning it too, but I'll mention a couple things. So further, one of the important things about the drops, okay, I know a lot of people, you mentioned the drops, taking the drops. There was some work done on the drops before our companies merged together to form PartnerCo. So I came from one side of the business, and there was some work done before. And I know that there were Dr. Ray Strand was involved in some of these things as well. There was a study done where they looked at, somebody might be familiar with this it's a smaller study, but people were given different products, part of the Slenderize program, and their weight loss was tracked, as well as some things like C-reactive protein and lipids, blood lipids, and so forth. And there was one group that was just given the drops only. You just get the drops, and then the one group is given the drops plus some optimals. Well, my screen's blurred on this thing, sorry, but the optimals and Restorex, to help detox the body. And then another group was given all the products, and then there was a control group where they were just everybody was given a calorie restricted diet, and they tracked weight loss. Now, of course, the people who were just on the calorie restricted diet only, they lost some weight, but you saw better gains when people were taking the drops. Statistically significant compared to the control group that was just doing only calorie alone. But then, so this is the catalyst, right? There's something else going on here than just calorie restriction, because we're seeing better weight loss. Well, then you add in the optimals and the Restorex, and there was a little more weight loss than happened before. And then when you add in all the products, you have even greater. So there's some synergy going on between all these products, right? So I mentioned this crosstalk, this influence. And so the drops themselves, there's some things in like Accelerate. The reason it's called Accelerate is because it can accelerate the benefits of these other drops. This homeopathic formula for these day drops, you take them before each meal, right? Helps control appetite. There's multiple things probably going on there as well, more than we understand fully. But some of that is going to signal, hey, don't eat as much. It's going to Accelerate helps. You have things like the methylcobalamin in there that help with conversion of energy from the food that you do eat. You're more satisfied, you have more energy. There's a bunch of things like that going on. And then you add in some of the other products, like for instance, Pure Nourish. I don't know if that's a discussion in this or not, but Pure Nourish, okay, and Power Boost, what do they bring to this equation? They bring some protein and amino acids. Now, I will get a little geeky here, if it's okay. There's a called mTOR, MTOR. You can look that up if you want, but it responds to nutrients and especially amino acids. It's a whole pathway, biological pathway in the body, and these amino acids basically do the cell signaling. So the mTOR sort of takes in all these inputs from the what's going on in the body and different nutrients and phytonutrients and things, and then it directs traffic afterwards. Hey, let's ramp up this response. Let's tamp down that one. These kind of things, sort of like a traffic cop maybe. And that again is a process that gets unregulated or dysregulated in certain cases like diabetes, obesity, and so forth. And so we're providing these amino acids plus other nutrients, and this mTOR responds to that and says, okay, we're going to change how we're metabolizing, how we're converting or utilizing energy. We're not going to do as much fat production. We're going to do more muscle. We'll make more muscle, or we're going to ramp up metabolism and burn more energy, things like that. So was that too much, James?
No, that's great. Fantastic. So guys, what I'm getting so far is, how does this system work? I just love that visual. Is you are the pattern disrupt of bringing positivity into a negative environment. Our bodies are all jacked up, and these ingredients are doing something to shift it so your body can actually work. And it's statistically significant. Like, these things are actually doing something. I want to ask about some of these ingredients though, because I think that's the part that, like there's Accelerate that has things like vitamin B12 or the methylcobalamin, like you mentioned, and other ingredients as well too. Those I think are more commonplace. We understand that they're out on the market. They're powerful as well too. Adaptogenic herbs, all that. But I think the part that is less understood is the homeopathic science of things. Like when you take a look at the ingredients and you read things like, and I'll share my screen on this. You read these ingredients like ammonium bromodium 12x, avena sativa 6x. If you're not familiar with homeopathy, you're like, what is this? I have not read this on my food label before. But could you touch on maybe even one of the ingredients, what homeopathy is, and like what that ingredient actually does?
Okay, I'll do that. So you got to get a little history lesson here. There was a German physician chemist, a couple hundred years ago, who developed this system of medicine called homeopathy. And what he found was, I'm going to see if I can really summarize this so everybody understands this. Okay, the idea of like cures like. So, so something that might cause a negative symptom in a person, if you take that and you treat it a certain way where you dilute it down, so you're in a salt like water or an ethanol alcohol, grain alcohol or something, that you're retaining. So this is according to his theory, right? You retain the vital energy of that while removing that substance, to where it's almost to the point where you can't detect it anymore, but that vital energy is supposed to remain. And the more you do, the more you go through this successive dilution through a certain process, that this potency of the positive part of it increases. So it's hard to wrap our minds totally around the science and the physics of that. But the thing with homeopathy is you have to look at, sort of what are the results. So this is where we come back to like a study like this, what is it doing in people? So there's actually quite a following of homeopathy in the United States and other places around the world, because of one, it's technically inherent safety, because you removed any toxic. Now, those ingredients you just read, those aren't really toxic, but they're safe. Anyhow, one of them is, you got oats and you got some, minerals that they take, and then, and they dilute down. But this is based on a couple hundred years of observation of this material, and the 6x means it's actually it shows the dilution, the dilution rate, but it also represents the potency according to homeopathic theory.
So the more diluted, the more potent. Is that what it means?
Yes. So that makes sense. So it's the idea of like cures like. So that's what that is. Now that was so again, it's the homeopathy. There's a lot of work been done on research on it, and but you have to look at the result and the observation over time, people's experience. And so that's where we are. So this was developed. I was not involved in this. This was developed before companies merged, but they did that work. Somebody had gone through, taken the time to say this formula based on these ingredients. So I've looked them up to see what they do. So a lot of them are related to helping with weight management and obesity and so forth. And so the exact mechanism, now I can give you some theory of what I think might be going on.
Yeah.
Okay. So the actual vital energy part, that actually might be happening. Okay. There might also be, think of it this way. I don't want to get into vaccines and controversies there or anything, but just the idea of a vaccine, right?
Yeah.
You give somebody a part of a virus or something that mimics the part of a virus, right? And then the immune system responds. And then the idea is that you develop an immunity towards this, right?
Yeah.
So think of homeopathy as you have something in that you're presenting in this dilution here to the body in a small amount that doesn't cause potentially a big adverse response, but actually is enough to get the cell to trigger a response, right? This enough to say, okay, I see this, here's a response to that, but it's, the idea of higher doses would cause problems, right? It's going to gear up all this machinery, the cellular machinery, everything that needs to deal with this, but it's not really there in that amount to cause a problem. But because it's already geared up the response, then it actually can do something beneficial dealing with that problem. So that might be a little too deep a dive.
That was a great explanation. Like heals like. The vaccine analogy makes total sense, but a positive vaccine, so to speak, a healthy one. So there's no negative side effects because they're so diluted, but they're potent with that. And what would be like one of the ingredients and what it does, like one of the homeopathic ingredients? Does anyone know that? Yeah.
That one is a mineral. And so that actually, there are multiple things that it does. And you can actually, you're mentioning that sheet there. And let me see if that one actually, I printed off these because I hadn't really looked at these. I kind of did all this on my own research. So, that's what I do. I just dig into it. But that one, there are some things where, so they have anti-inflammatory actions and so forth, but usually there's multiple things they do. So each one of these things is actually included in there because they have had some experience with weight management over time. Have you ever heard of something called German Commission E monographs?
No, I haven't.
Okay, well,
Lindsay's saying she hasn't as well.
Okay, that's a German one, but they actually have a pathway for registering herbal medications in Europe. So here in the United States we sell them as dietary supplements, and rarely do you get a prescription for them, right? But there in Germany and places like that, they actually have this whole process set up where you can get a prescription for an herbal medication if you don't want a synthetic pharmaceutical drug, right? But it's based on generations of experience that maybe we don't fully understand why it does what it does, but here's what everybody has known for a long time it has done. And so they developed that. So in the case of these homeopathic preparations, it's sort of what it is based on lots of experience. That this seems to help. Now, is this true or not? Well, I would ask the question, James, is it true? Because you use the drops. What do you think?
I think it is. And I've seen it just consistently over time. It's like, wow, it's working.
Yes. So while sometimes we can, now I gave some explanations like methylcobalamin and the accelerate, and there's some things we do know, but there is a lot we still don't know of how things work. And that actually is the case with even some of these things you can buy over-the-counter drugs. Some of them traditionally a long time. Some of them you read actually get into the pharmacology of it, like I did in school, and study it. And they said, we think it does this, but we're not totally sure. We just know it. So there is room for that in these things that, the proof anyhow is in people. Yeah. And so I mentioned this study earlier about where they took the drops and then they compared them to other groups and they saw a difference. And the experience that all the people have here with these products also is important. And so, so I don't want to shoot down your question. You ask, well, how is it doing? Exactly. Well, sometimes we don't fully understand. And that actually is the case for a lot of things. And, I could talk about noni. The reason I still do research on noni is we are understanding it more and more, but we don't have everything figured out. We don't have everything figured out for anything, So, I mean, why is it we're not on Mars right now? There's another example. Still working on it.
This is why we love you. Like, I think any true researcher or scientist, for anyone listening to this, run away if they have the other perspective. We know it all. This is it. This is truth. Science, medicine, everything is constantly innovating, constantly getting better, constantly evolving. That's why it's the practice of medicine, for example. Like we're practicing these things. So I love that you gave the perspective on even for medicine and drugs, it's the same thing for homeopathic remedies or natural holistic solutions like this as well too. And we appreciate you being at the forefront of research and development, constantly coming out with more studies as well too and everything. Quick question on this, Brett. So to tie off Slenderize, with the homeopathic ingredients, because they're so diluted, does that mean that we should have no concern about any side effects that there might be if they're like in big quantities?
Yes, that's the thing about homeopathy is there is an inherent large margin of safety in homeopathy. And that's one of the reasons why they're so popular is because you, you just, you're more concerned about the solvent, whether it's an ethanol or a water, and that's, that's not the issue, right? These ingredients are not the issue. It's whether it works or not is the issue, not whether they cause an adverse response, is if they're done properly. Okay. Now, I'm not going to give a blanket statement. I just mentioned about noni. Remember fake nonis? 75% of the market fake noni, and we, our source we can control. We have real noni. So I'm going to say for these guys, you're good. So, ours. But that doesn't mean brand X down at the market corner of the, the street there is going to produce that. But if they're done properly and according to the principles and the guidelines given, then yes, you have a very large margin of safety.
Powerful. Guys, put a 1 in the comments if you got any nuggets already so far. This is just, I could listen to you for days, Brett. Like, I love the way you communicate this. Like, it's making sense for me. And by the way, we're not going to be able to get through all the questions, but I'm going to leave my email here as well too. If you have questions that are not answered today, feel free to shoot me an email. And then that's what I love about Brett. He's always sharing knowledge. He's always giving information. I think we might have time. Cindy, Lindsay, let me know what you think. Maybe like one more product. I'm thinking noni for, is that okay with you guys? Okay, cool. So I think it would be a miss and a shame if we did not talk about noni, because you are literally looking at the foremost expert on Tahitian noni juice on the planet. Like literally, that is who Brett West is. And noni itself, for those of us that are either familiar or maybe we need a refresher. So how do you describe what Tahitian noni is and what some of the benefits are?
Okay, so I'll try to be very brief. I've given presentations in the past that have gone like 4 hours on this.
Sign me up.
But we'll, okay, so noni is, if you don't know what it is, it's a tropical fruit, grows year round. It's from the tropical regions of the world. The Polynesians who colonized the Pacific Islands took it with them from island to island, made sure they had it with them, and carved out space, made room for it on their canoes. And they actually took the best stuff as they went, across colonizing the Pacific from island to island. And when you get out to where French Polynesia is, where ours comes from, you actually have the strongest noni. And we know that's the case because we have done research, published that research on a group of phytonutrients called iridoids. These are what make noni unique from other fruits. Just to give you a brief example of this, we did a clinical trial at the University of Illinois College of Medicine in heavy smokers, people smoking a pack of cigarettes or more a day. And we actually did several studies with these people, but we had a placebo-controlled trial. I actually designed the placebo to contain everything in Tahitian noni juice except the noni. And I used a strong European cheese flavor to mimic the noni flavor. There's more about that story later on about these medium chain fatty acids that noni produces naturally. Some people call it cheese fruit in some places, but anyhow, we have the blueberry and the grapes and all these, these are high antioxidant, high flavonoid juices in there. And, but we split the people up into 2 groups. Again, people are smoking 19 or more cigarettes a day, or a pack of cigarettes a day, which, is wreaking havoc on their body. This is highly a real problem. And we actually, the person, Dr. Min-Ying Wong, that was the head of this, she's a cancer researcher. So this is kind of why we did this. We wanted to see what protective effect does it have on the body and how does it compare to other fruit juices? Is there anything special? So we teed it up. We spent the money to see, is this really something unique. So what the result was is that they drank either the placebo or the Tisha noni juice for a month while they continued to smoke. We drew blood and tested the DNA damage that occurred in the white blood cells, that's immune system cells, of these smokers before and then after this trial. So, and what we saw is that the placebo wasn't strong enough, despite all the other good antioxidants in there. It wasn't strong enough to make a difference against that amount of harsh conditions from the cigarette smoke and damaging the DNA. But the TNJ with the noni in it actually reduced DNA damage by half.
Wow.
By half. And so we actually looked at a bunch of other things, but we said, what is it in there that's different about noni? So we did more phytochemical research and we found iridoids, unique. You can't get them in grapes. You can't get them in acai. You can't get them in oranges or bananas or anything like that. You got to get noni. So now that's Tisha noni juice. And it gives you an example of how powerful it is in protecting the body. Now we see it traditionally used for, 60 plus conditions, in Pacific Islands. And in fact, it was documented before we ever started the company or commercially produced this. Other ethnobotanists had said that it was the most important medicinal plant among the Pacific Islands prior to the arrival of Europeans, who kind of changed everything, sort of the system. And what does it do? It does lots of things. So it helps with joint health, inflammation, it boosts the immune system. In fact, in China, we have an officially approved health claim for Tahitian noni juice in China as something that boosts immune system activity and is good for people with compromised or suppressed immune systems. We have a little symbol on there. Not very many people get this, but we have that. And that's been through, we did all the testing and we had to do our own testing, and then we had to do the testing that the government asked us to do and go through a lot of work. But to give you an example, so it boosts the immune system. It helps is a powerful antioxidant, like I mentioned, and protects the DNA. It helps with endurance, physical endurance. So if you use the drops and you drink TNJ and you add that in, that's a good program, because we actually did a study on that as well with obese people. And I'll probably finish here with this description of this study. We did a study, about a 9-week study, and we enrolled people that were grade 4 obese. And this is the weight they had on there. Just notes, because I'm going to come back to this real quick, but I just want to mention, James, the people that there's a study. Let's see if I can get that focused. Well, maybe not. I'll put it right here.
Yeah.
This is published and it's on PubMed. And you type in the potential health benefits of noni juice, and that's a review of. And this one only included about 18 clinical trials on Tisha noni juice, but you can read a lot about what noni does, and it's pretty technical. But if you want to, there you go. Right? Yes, that one. So go look that up. And this one's mentioned in there, but just to give you an example. So in this study, it was kind of like the drops. You took people, in this case, these people were, the average weight was about 280 pounds. These people enrolled in the trial. And they all were put on a low calorie diet and, some exercises, but one group got TNJ. And then you tracked them over time. And so they had an in-clinic phase for the first 3 weeks. And then they all lost weight like you expected. But then they went home and out of clinic phase. And the people that weren't on the TNJ group, they're still doing this low calorie diet. They rebounded and gained weight. They gained back about almost 7 pounds on average. But the people drinking the TNJ dropped an additional 8 pounds on average compared. So they kept dropping. The other group was rebounding. So this happens in weight loss often. So what's the difference? The difference was, we measured lean muscle mass or muscle. Lean body, or muscle mass. When you restrict calories a lot, you're going to lose weight through fat loss and muscle loss, right? Your body's going to pull some nutrients out of there and start burning stuff. And that's why it's important also something like Pure Nourish to keep the muscle, provide protein. Not only does it help your metabolism, but you need stuff to replace protein, muscle with, because the muscle long-term will help you continue to lose weight. It burns things better. That muscle is a good engine for burning calories. But in this TNJ group, they had less loss of muscle mass than the control group just by drinking some TNJ every day. And in fact, it was like the the muscle loss was 16% in the control group, just diet alone. And the TNG group, they only lost 4%. So why is it? Yeah, much less muscle loss. And so that meant that their basal metabolism stayed higher in the TNJ group than the other group. And we did additional studies with athletes to actually figure out why that is. It's the TNJ is protecting the muscle, conserving the muscle. So I would say, you want to add that into your regimen. You've got some biohacks to your disposal.
Wow.
So
how does it protect muscle? Just curious if you know the mechanism.
Well, we're still working that one out. We know it does by measuring something called creatine kinase, which is a marker of muscle damage. We saw that with athletes because it improved endurance in athletes as well. When these were runners and cyclists and different athletes, we did different groups and saw the benefits it had in helping improve endurance. And one of the things we thought is, let's see what happens with muscle damage when you really excessive exercise. A certain amount you want so you can build muscle and respond, but too much is bad and it makes slow recovery. But we saw this muscle protective effect. I could get into the cell biology on it a little bit, but basically there are some oxidative damage processes that it's actually muting, so it doesn't cause as much. So
makes sense.
So I don't want to get too nerdy on you.
For sure. We'll do that as a part 2. By the way, guys, if there was a part 2 with Brett, put it 2 in the comments if you'd like to be a part of that. Like, oh my gosh. So
yes. Hey, Brett, quick
yeah.
question. How much noni juice were they taking during all of this?
So we have on our label, okay, you'll see sometimes it's 30 mils or 60 milliliters, 2 ounces. They were drinking about a half a cup. So not a lot more. In fact, if you can work it in, I would tell people, we see from our smoker studies benefits at 1 ounce. I mean, that's definitely there. And we've also seen benefits. But if you can do more, then do it. And from a safety standpoint, we've done safety trials on this as well. We had people drinking 3/4 of a bottle a day for a month and measuring everything on them that you could measure, and they were fine and healthy. In fact, it improved their overall health when others were getting sick and so forth. They weren't. So our placebo group people were getting, they catch regular things, the rates in the TNJ group were way down.
That's incredible. So incredible.
Well, thank you so much, Brett. I'm going to pass it over to Cindy to close things off with Brett. But Cindy, how you feeling?
Oh my gosh, I am all about part 2 because there were some other products we did. I saw somebody say, can you talk about Renew? That was on our list along with the Fucoidan, which I'm a huge, huge fan of that particular ingredient as well. But I just gained so much knowledge and excitement, really specifically about the noni. I mean, I've already been excited about the drops. I've already been excited about the noni. But really, really hearing it directly from you, Brett, about just what noni does and has the ability to do in our bodies and for our health. I don't know about you guys, but who is not going to miss the TNJ? I put in the comments too, in case you didn't know what that was. It means Tahitian noni juice. Who is not going to miss their dose of noni any day in the near future? Because that is me. I saw some people say they use it as their pre-workout. I definitely notice when I am out of my noni juice that my energy is not, my focus is not where it is when I'm taking it. I had no idea why. I still don't really know why, but hearing Brett kind of validate that makes me feel like, I'm not crazy. It's not a placebo effect. It's real. So if you did not know anything about noni coming into this, I would highly recommend definitely looking at those articles on pubmed.gov. I know that I will. They look super fascinating. They do a lot. It does a lot of different things. And if you or somebody you know has any kind of issues, it might be something that's really great to pass on as well. Okay. So we are just so thankful that you got to sit with us here today. If you have any questions, definitely reach out to the person who invited you to this. and we can get those questions answered for you. And if you are not a brand partner here yet, or you're thinking about becoming a customer, absolutely reach out to the person who invited you here and let them know that you are ready to try Noni and the drops. That is an incredible, incredible duo. By the way, if you are here and specifically looking for weight loss, that's an incredible combination right there. Brett, thank you so much. James, thank you so much. We appreciate your time so very much. We know that you guys are super busy, and we are just so thankful that you took this time to spend with us today. All right.
Thank you
Pleasure.
so much, you guys. Have a wonderful day.